So, what could be the nursing interventions for different types of seizures? This would be one of the better areas of questions falling for your Nclex examination, and you may have noticed in the other lecture too that I advise you to focus more on the nursing intervention or nursing management part for your Nclex examination. First important thing, a seizure may cause a patient to fall if he or she is standing, so your first response would be to make him lie on the floor or bed. Second, as with other acute emergency conditions, see for managing the ABC or airways, breathing, and circulation. Third, many seizures comes with the secretion, so your duty would be to tilt the head of the patient and take out the secretions, as these may cause difficulty in breathing. After that, as we learned that there are different types of seizures, we need to notice the duration of occurrence and pattern of the seizure. We may need to identify whether the seizure is short absence type or myoclonic or tonic-clonic, or just the types of partial seizures. This will help to identify the management or treatment approach for the seizure. So after learning about the introduction, types, and nursing management approach for the seizure, equally important for your Nclex examination is pharmacological intervention and nursing approach to the patient taking the anti-seizure drugs, which we will focus in this lecture. The main anti-seizure medications are carbamazepine, phenytoin, lorazepam, gabapentin, pregabalin, phenobarbital, and clonazepam, etc. Let's only focus the main pharmacological points on these drugs, which could be important for your Nclex examination. One thing you may need to note is these drugs should be used with care or continuously monitored for patients who are on antipsychotic or anticoagulants medications like warfarin already, as they may cause medical interaction. Also, some supplements, milk, and antacids can interfere with its absorption, so your job will be to instruct the patient not to take these drugs or supplements or antacids when the anti-seizure medicines are being given. Let's talk in brief about one of the drugs called Phenytoin, as it is more of topic of choice in examination. Note that Phenytoin is basically used to treat tonic-clonic and partial seizures. There could be various side effects of this medication. Some examples are swelling and bleeding of the gums, headache, nausea, vomiting, constipation, dizziness, feeling of spinning, drowsiness, trouble sleeping or nervousness, etc. So, what could be the nursing intervention for a nurse carrying a patient who is taking this drug? We studied that one of the side effects of anti-seizure drugs like Phenytoin is bleeding of the gum. So we should instruct the patient to take a good care of the oral hygiene and oral health. The drug Phenytoin can increase the metabolism of estrogen, which is contained in the birth control pills. So it can decrease the efficiency of birth control pills. So birth control pills cannot be totally relied as a family planning medication if the woman is taking Phenytoin. Next, this drug is also a Category D medication which may impart harm to the growing fetus. So far as possible, it is best to avoid using drug according to the prescription and discussion with healthcare worker if the woman is pregnant. Similarly, as we talked before, we should instruct the patient not to give these drugs concomitantly with milk and antacids or any calcium supplement, as they may delay the absorption of these drugs. Some of the medicines may cause drowsiness or dizziness or even visual impairment disturbances, so we may advise the patient to be more alert and conscious if he or she is already in the anti-seizure medical therapy. And if there is excessive and frequent symptoms of side effects, including bleeding from the gums, headache, nausea, vomiting, constipation, dizziness, feeling of spinning, drowsiness, trouble sleeping or nervousness, etc., the patient may need to refer to the doctor.